Public Health Director Jim Gillen says he'll be the first to admit their old policy statement limiting access for Medicare and MIP programs are, quote, flawed. PNC's Rebecca Elmore has more details with the story.
The Department of Public Health and Social Services Director James Gillen is admitting that their old policy statement limiting access for Medicaid and medically indigent program patients at the Guam Regional Medical City is, quote, flawed. In a release last week, Public Health announced that they will begin covering all services at GRMC for Medicaid patients immediately after they instituted a policy last December that limited coverage to emergency services only. Following that announcement, GRMC issued its own statement saying, quote, Public Health has recognized that their initial interpretation of their obligations under the provider agreement and the Guam state plan was flawed, end quote. In response, Public Health Director James Gillen says he couldn't agree more.
They're correct, okay, because they reminded us that patients have equal access. So to put the policy in effect to only restricting the use of that hospital to emergencies was flawed.
Each state is given a plan that dictates the amount of coverage needed for Medicare and MIP. Gillen says Guam is no different. Only, according to Gillen, the island's plan needed an update 30 years ago.
What they found actually in our own state plan, there's an item in there that's over 30 years old that said clients have free access. Okay, so we had to backtrack and say, okay, you're right.
Gillen adds that if it were not for the Affordable Care Act, Guam would technically not be able to pay for the coverage needed this year. The U.S. Medicaid website states that, quote, the period of July 1st, 2011 through September 30th, 2019, Section 2005 of the Affordable Care Act, provided an additional $268 million in Medicaid funding to Guam, end quote. But with public health dangerously teetering on the precipice of no local funding to match federal grants, Gillen says it will take a lot of, quote, artful arrangements.
That Affordable Care Act money goes away December 31st, 2019, so there's no extra money to tap. So we need to work now, between now and then, on finding a reliable source, a continual reliable source of funding.
In a breakdown he provided to PNC, Gillen wrote, Guam's economy is heavily dependent on the tourism industry and U.S. military spending. Thus, revenue is unstable. As a result, the government is unable to guarantee the availability of local matching funds for the federal grants received, end quote. Unlike many states, Guam does not receive 100% federal funding for Medicaid. The local government can only receive the federal funding if it puts up a match of 45%. Based on the data he provided, the Medicaid program expenditure for fiscal year 2016 totals a whopping $105 million. Initially, GRMC determined last month that their per diem rate would go from $1,000 to $5,000, nearly 4 times what Public Health was expecting. He says only until Public Health submits a newly updated and approved Guam state plan will they be allowed to negotiate a, quote, somewhat lower rate. In the meantime, Gillen says Public Health will, quote, make every effort to work closely with the administration and the Guam legislature in securing the necessary funding, end quote. Reporting for PNC News, I'm Rebecca Elmore.